Hi, my name is Heidi Lane, and I'll be presenting on acne. So, some physical characteristics about this bacterium is it's called Propanoibacterium acnes. It is a gram-positive, anaerobic, and non-spore-forming bacterium. It is relatively small with a diameter ranging from 0.5 to 1.5 micrometers. The colonies of P. acnes typically appear white or colored when cultured. It is anaerobic. P. acnes is an anaerobic bacterium, meaning it thrives in environments with little to no oxygen, and its preference is reflected in its role in the sebaceous regions of the skin, which can be relatively anaerobic. P. acnes primarily obtains energy through the fermentation of sebum, the oily substance produced by sebaceous glands in the skin. It can tolerate acidic conditions, which significant since the skin's pH is mildly acidic. So P. acnes is commonly found on human skin, particularly in areas rich in sebaceous glands such as the face, neck, chest, and back. It colonizes hair follicles with a preference for the sebaceous follicles connected to hair shafts. And while P. acnes is anaerobic, it can also tolerate low levels of oxygen, which is important considering the skin is not entirely devoid of oxygen. The acne is also known to form biofilms, which are communities of bacteria embedded in a slimy matrix. Biofilms can provide protection and help bacteria adhere to surfaces, contributing to the persistence of P. acnes in the sebaceous follicles. P. acnes is not necessarily a pathogenic bacterium, but becomes problematic when it proliferates in excess. This overgrowth, combined with other factors like increased sebum production and clogged pores, can contribute to the development of acne lesions. So the virulence factors for P. acnes, P. acnes expresses surface proteins that act as adhesins, facilitating its attachment to host cells and surfaces within the sebaceous follicles. Adherence is a crucial step in the colonization process. P. acnes is known to form biofilms, which are communities of bacteria embedded in a self-produced extracellular matrix. While P. acnes itself may not produce classical toxins, it can induce inflammation through the activation of the host immune system. It stimulates the release of inflammatory mediators such as cytokines and chemokines, contributing to the inflammatory response seen in acne lesions. And P. acnes produces lipases that can hydrolyze sebum triglycerides into free fatty acids. Increased levels of free fatty acids in the sebaceous follicles can contribute to inflammation and the development of inflammatory acne lesions. P. acnes can activate toll-like receptors, or TLRs for short, on host cells. TLRs are part of the innate immune system and play a role in recognizing microbial components. The activation of TLRs by P. acnes can trigger inflammatory responses. So some symptoms for P. acnes is acne manifests as a variety of skin lesions, including comedones, which are blackheads and whiteheads, non-inflammatory lesions caused by the accumulation of sebum and keratin in hair follicles, papules, small red raised bumps caused by inflammation, pustules, inflamed lesions containing pus, nodules and cysts, which are more severe, deeper lesions that can be painful and may lead to scarring. Acne commonly appears on the face, neck, chest, back, and shoulders, which are areas, again, rich in sebaceous glands, but these acne spots can be painful. So there are many treatment and prevention options for acne. Starting with topical treatments is benzoyl peroxide. This is the over-the-counter medication that has antibacterial properties and helps reduce P. acnes on the skin. It also has anti-inflammatory effects. Topical antibiotics, more of them is prescription antibiotics such as clindamycin and erythromycin can be applied to the skin to help reduce P. acnes colonization, and inflammation. Retinoids are also effective, topical vitamin A derivatives. Products containing adapalene, tretinoin, and tazarotene help prevent the formation of comedones, again, which are the blackheads and whiteheads, and have anti-inflammatory effects. Oral antibiotics such as doxycycline, minocycline, and tetracycline may be prescribed for their antibacterial and anti-inflammatory properties. Oral contraceptives. So for females, certain birth control pills that regulate hormones can be effective in managing acne. Isotretinoin, reserved for severe cases, is a powerful oral medication that reduces sebum production and is highly effective, but it comes with potential side effects and requires careful monitoring of the patient. Topical retinoid combinations. So some medications combine topical retinoids with other active ingredients, providing a multifaceted approach to acne treatment. Lifestyle and skincare practices such as gentle cleansing and avoiding harsh products. So harsh skincare products can cause excessive irritation to the skin and worsen acne. And making sure we're choosing not the patient is choosing non-comedogenic products or oil-free skincare and makeup products to minimize pore blockages. Phototherapy has also been proven useful, so certain light-based therapies such as blue light and red light treatments can help reduce inflammation and kill bacteria. Chemical peels performed by dermatologists involve applying a chemical solution to the skin to exfoliate and improve acne. And also dietary changes. So while the link between diet and acne is very complex and varies among individuals as far as like other factors also, some people find that certain dietary modifications, such as reducing dairy or high glycemic foods, may help improve acne. And then something that can also help is just regular dermatologist checkups. So regular visits to a dermatologist can help monitor the progress of acne and adjust treatment plans as needed. So the pathogenesis of P. acnes is, again, it's a gram-positive anaerobic bacterium that naturally resides on human skin. So this bacteria colonizes hair follicles and sebaceous glands where they utilize the sebum produced by these glands as a nutrient source. And increased sebum production can come from hormonal changes, particularly during puberty. Androgens such as testosterone stimulate the sebaceous glands to produce even more sebum, and the excess sebum can contribute to the development of acne by creating an environment conducive to bacterial overgrowth and the formation of blackheads and whiteheads. P. acnes also plays a role in the development of comedones, which form when hair follicles become clogged with a combination of excess sebum and dead skin cells. P. acnes contributes to this process by interacting with the sebum and keratinocytes within the hair follicle. The presence of P. acnes in the clogged follicle triggers an immune response, leading to the release of inflammatory mediators such as cytokines and chemokines. And inflammatory acne lesions result from the inflammation caused by the immune response to P. acnes. And neutrophils and other immune cells are recruited to the site, leading to redness, swelling, and the formation of pustules containing pus. So P. acnes, as we already talked about, it is known to form biofilms, and biofilms can adhere to the surface, including the walls of hair follicles, making it challenging for the immune system and antibiotics to eliminate these P. acnes spots. In severe cases, inflammation can lead to the development of nodules and cysts, which are deep, painful lesions, and these can cause scarring and may require more aggressive treatments. So P. acnes also has a social influence, self-esteem and body image. Acne can significantly impact an individual's self-esteem and body image. The visible nature of acne lesions, especially on the face, may lead to feelings of self-consciousness and a negative self-perception. Acne has been associated with increased rates of anxiety and depression. The psychosocial impact can be particularly pronounced during adolescence, a time when individuals are already often more sensitive to societal beauty standards. There's also a social stigma surrounding acne, and they may face social stigma or teasing, and this can contribute to feelings of isolation and affect social relationships. Individuals with acne may alter their behavior to avoid certain social situations or activities impacting their daily lives and potentially limiting opportunities for social engagement. Cultural perception of beauty standards are constantly changing, and they play a role in how individuals perceive themselves and how others view them. Cultures where clear skin is idolized, the presence of acne may be particularly challenging for individuals. It also affects the workplace and education. The psychosocial impact of acne can extend to professional and educational settings where the patient with acne may feel judged or face bias, potentially affecting job interviews and career advancement or academic performances. Socioeconomic factors also play a role in acne. Access to healthcare, including dermatological care for acne treatment, um, may not be available to everybody. And then it is also heavily influenced by the makeup and cosmetic industry. Um, Makeup is often advertised to young women to be used to cover up, and that can make them feeling like they should be ashamed of their acne, whereas it's out of their control often. There are also some acne awareness campaigns that have been started to increase awareness and advocacy for mental health and body positivity to contribute to changing societal attitudes towards acne. And that's the end of my presentation. Thanks for watching.